The charge nurse said her name out loud at 11:47 p.m., and I had to read it twice on the intake form to make sure I was seeing it correctly. Vanessa Collier. Formerly Vanessa Park. Now Vanessa Collier. Which meant she was married to him. Which meant the woman on the gurney being wheeled through the doors of my emergency department with a blood pressure of 78/42 and a heart rate of 134 and a presentation that my resident had already correctly identified as cardiogenic shock. That woman was Marcus Collier's wife. Marcus Collier, who had sat across from me at a restaurant table in Hyde Park on a Saturday night in October 2013 and said, in the particular voice he used when he wanted to sound like he was being helpful, "Raina, I think you need to be honest with yourself about whether medicine is really the right path for you. Not everyone has what it takes. And I think if you're being genuinely honest, you know that you're just not built for it intellectually." He said I was not built for it intellectually. He said this to me on a Saturday night, while I was in my second year of medical school at the University of Chicago, while I was sitting across from him with a 3.88 GPA and a research position in the cardiology lab of Dr. Emily Soto, one of the most respected cardiac researchers in the Midwest. Not built for it intellectually. I looked at the intake form. Vanessa Collier, 41 years old, brought in by ambulance from the Waldorf Astoria on Michigan Avenue, where she and Marcus had been attending some kind of event. Cardiac event in the elevator of the hotel. Bystander CPR initiated. Paramedics arrived in 6 minutes. She had been in VFib in the field, cardioverted once in the ambulance, now in a narrow complex tachycardia with a pressure that was not compatible with anything other than immediate intervention. My resident, Dr. Jonah Park, no relation to Vanessa's previous surname, I checked because the night was already strange enough, looked at me across the trauma bay. He said, "Dr. Raina, she needs the cath lab." I said, "I know. Get cardiology on the phone. Tell them we're coming up." He said, "Do you know her?" I said, "Her husband. Briefly. A long time ago." He looked at me for 1 second. He said, "Are you?" I said, "I'm fine, Jonah. Get cardiology." He got cardiology. And I went to the bedside of Vanessa Collier and I did what I do. What I have been doing for 11 years. What I was told by the man who married her, that I was not built to do. But I'm getting ahead of myself. Because to understand what that night meant, what it actually meant, beyond the surface level satisfaction that I will be honest with you about feeling for approximately 90 seconds before it was completely overwhelmed by the clinical emergency, you need to understand what came before it. Who I was when Marcus Collier said what he said. And who I became after. Let me take you back to 2011. Not to the beginning of who I am. The beginning of who I am starts much earlier, in a specific apartment in Pilsen on the southwest side of Chicago, with my grandmother's hands and a story she told me that I will come to later. But for the purposes of this particular story, we start in 2011. August 2011. I arrived at the University of Chicago Pritzker School of Medicine as a first-year student. I was 22 years old. I was the daughter of Esperanza and Rodrigo Raina. My mother a registered nurse at Cook County Hospital for 26 years. My father a union electrician who had worked on half the major construction projects in Chicago in the 80s and 90s. I had grown up in Pilsen, gone to high school at Benito Juarez Community Academy, gotten a full scholarship to the University of Illinois at Chicago for undergrad, graduated in 2011 with a 3.91 GPA, and an MCAT score of 36. The scholarship that brought me to Pritzker was the Shapiro Family Foundation Medical Scholarship, which is given to 3 students per year from underrepresented backgrounds in medicine, and which covers full tuition plus a living stipend of $24,000 annually. It was, in the most literal possible sense, the thing that made medical school possible for me. Because my parents, who had worked their whole lives, who had given everything they had to give, who had put 3 children through college by the specific alchemy of financial aid and work study and my mother's meticulous management of a household budget, did not have the resources to fund a medical degree. The scholarship was not a lucky break. It was the direct result of 4 years of undergraduate work designed specifically to be worthy of it. I need you to understand that. I need you to understand who I was when I walked into Pritzker in August 2011, because Marcus Collier's words in October 2013 cannot be properly understood without knowing who they landed on. I met Marcus in October 2012, first year of second year. He was not a medical student. He was a second-year MBA student at Booth, which is the University of Chicago's business school, and I want to be accurate about this because the story is not served by making him a cartoon. He was genuinely impressive in certain ways. He was intelligent. He was articulate. He was from a family in Winnetka that had sent children to the University of Chicago for 3 generations, and who had a specific relationship with the institution that felt like ownership in a way I had not previously encountered and did not fully understand. He was charming in the particular way of people who have been well treated by the world and have mistaken that treatment for a reflection of their own qualities. We met at a department mixer, the kind of event that medical schools and business schools organize in the spirit of interdisciplinary connection, and that mostly results in medical students talking to each other and business students talking to each other, with occasional exceptions. I was one of the exceptions. Marcus had been standing near the food table making a point about healthcare economics to someone who clearly wasn't fully engaged, and I had walked over because the point was interesting and also partially wrong, and I had said so. He had looked at me with the expression of someone who is not often contradicted in social settings and who finds it either offensive or interesting, and in his case it was interesting. We talked for 40 minutes. He asked me to dinner the following week. I want to be honest about why I said yes. Not because Marcus Collier was the love of my life, he was not, and I knew he was not even in the early months, though I would not have said so at the time because I was 23 and lonely in the specific way that medical school makes you lonely, with the constant pressure and the constant hours and the way the work colonizes the space where the rest of your life is supposed to live. I said yes because he was smart and present and he looked at me like I was interesting. And being looked at like you are interesting when you are 23 and in your first year of the hardest thing you have ever done is not a small thing. We dated for 14 months. October 2012 to December 2013. The first 6 months were good, not transcendent, not the kind of love that reorganizes your understanding of yourself, but genuinely good. He was interested in my work. He came to events at Pritzker. He talked about healthcare in ways that were sometimes wrong and that I corrected, and he received the corrections mostly with something that looked like genuine curiosity. The last 8 months were the accumulated weight of a specific incompatibility that I did not fully name until the restaurant in October 2013. Here is what the incompatibility was. Marcus had a relationship with achievement that was about the appearance of achievement as much as the thing itself. What he valued was the version of things that could be shown to a room, the salary that could be mentioned at dinner, the title that could be explained in a sentence, the career trajectory that fit on a business card and could be understood by his parents' friends at their club in Winnetka without any additional context. Medicine as I was living it did not fit that shape. Not in the early years. In the early years, medicine is invisible. You are studying, you are struggling, you are building something that cannot yet be shown to a room because it is not yet finished. You are broke. You are tired. You are frequently uncertain about whether you are going to be good enough, because the second year of medical school is specifically designed to reveal the limits of your certainty about yourself and then require you to keep going anyway. Marcus had no patience for the invisible years. He wanted me to be already finished. Already arrived. Already at the version of myself that could be shown at dinner. And so, over those 8 months the comments began. They started small. A question about whether I was really sure emergency medicine was the right specialty given the lifestyle. A suggestion that maybe healthcare administration would be a better fit for my personality. A moment at a dinner with his Booth friends where he explained my career aspirations in a way that was subtly and precisely diminishing, describing what I was doing as trying to get into cardiology rather than being in medical school, which was what I was actually doing. I noticed each of these things. I filed them. I told myself they were coming from a place of genuine concern and a limited understanding of medicine. I gave him more credit than he had earned. October 19, 2013. The restaurant was called Promontory, which was then relatively new, and which Marcus had chosen because he liked to be seen at new places. We were there to celebrate, notionally, my passing the Step 1 board examination, which I had taken in August and passed with a score of 242, which at the time placed me in approximately the 92nd percentile nationally. I had told him the score. He had said, "Is that good?" I had said it was very good. He had said, "We should celebrate." We went to Promontory. Over dinner, he told me about a job offer he had received from a consulting firm in New York. Significant salary. He mentioned the number 187,000 base, with bonus structure bringing it potentially to 240,000. He was excited. He talked about it for about 20 minutes. I listened. I asked questions. The questions were genuine. I was trying to understand what the move would mean for us, because if Marcus went to New York and I was in Chicago for 4 more years of medical school and then residency somewhere TBD, that was a calculation that needed to be made explicitly. I said, "What does this mean for us?" He looked at his wine glass. Then he looked at me. And then he said it. "Reina, I think you need to be honest with yourself about whether medicine is really the right path for you. Not everyone has what it takes. And I think if you're being genuinely honest, you know that you're just not built for it intellectually." The restaurant was not loud. I heard every word with the particular clarity of something your brain decides immediately to keep forever. I said, "What did you just say?" He said, "I'm not trying to be hurtful. I'm trying to be honest with you because I care about you. You've struggled with the coursework. Step 1 was, you passed, but it took you several weeks to feel ready, and..." I said, "I scored in the 92nd percentile." He said, "I know. But the process was hard for you." I said, "The process is hard for everyone." He said, "Not everyone, Reina. Some people find it hard. Some people find it natural. And I think..." I'm not saying this to be cruel, I'm saying it because I think you're smart enough to consider other paths. I said, "You think I'm smart enough to consider giving up medicine?" He said, "I think you're smart enough to be realistic." I looked at him across that table. Marcus Collier. Booth MBA. Winnetka. 3 generations at the University of Chicago. The consulting job in New York. The specific confidence of someone who had been well treated by the world and had mistaken it for insight. And I thought about my grandmother. I need to tell you about my grandmother now because she is the answer to Marcus Collier, though he didn't know it and I didn't frame it to him that way. My grandmother, Consuelo Reina, came to Chicago from Jalisco, Mexico in 1962 with $43 and a primary school education and a specific and unshakable conviction that her children and grandchildren were going to have the things she had not had. She cleaned houses for 30 years. She raised 3 children in Pilsen in a 2-bedroom apartment on South Ashland Avenue. She died in 2009, 2 years before I started medical school, and she never saw me get there. But when I was 11 years old, she had a heart attack. She was 68. She was brought to Cook County Hospital, where my mother worked, and she spent 8 days in the cardiac unit. And I visited her every day after school. And on the 3rd day, I was sitting beside her bed, and a woman came in to check her monitors and adjust her medication, and my grandmother watched this woman work with the specific attention of someone for whom attention is a form of respect. And when the woman left, my grandmother looked at me and said, "That woman is a doctor." I said, "Yes, abuela." She said, "She fixes people's hearts." I said, "Yes." She said, "Reina, you should fix people's hearts." Said it simply, like a fact about the world that had just been confirmed. I was 11 years old, and something happened in me when she said it that did not go away. Not a decision exactly, you cannot make a real decision at 11, but a direction, a setting, a compass point that I kept returning to for the next 11 years until I arrived at Pritzker. I thought about her on October 19, 2013 at Promontory, looking at Marcus Collier across the table. And then I said, "I need to go." He said, "Reina." I said, "I'm going to pay for my dinner. And then I'm going to go home and study, because I have an anatomy practical on Thursday, and I am going to do extremely well on it." He said, "I'm trying to have an honest conversation." I said, "You had an opinion. You shared it. I've heard it. Good night, Marcus." I paid for my dinner. I walked out. I took the Green Line home to Hyde Park. I sat at my desk. I studied anatomy until 1:30 a.m. I did not cry until I was in the shower the next morning. I want to be honest about the crying because the story is not honest if I leave it out. The crying was real. Not because Marcus Collier's opinion of my intellectual capacity had any actual bearing on my intellectual capacity. It didn't, and somewhere beneath the hurt I knew it didn't. I cried because I had opened a door to someone, had let him be present in the interior of my life where the work and the fear and the uncertainty lived, and he had used what he saw there to build an argument for my smallness. That is a specific kind of hurt. It takes a specific kind of time to metabolize. I gave it one shower. One morning. And then I got dressed and went to the anatomy lab and I was done with it. We did not formally break up for another 6 weeks because the logistics of ending things with someone you've been with for over a year take some time, and because I was in the middle of a semester and could not give the breakup the attention it deserved. But it was over on October 19th. Everything after that was administrative. He moved to New York in January 2014. I stayed in Chicago. I kept studying. 3rd year. Clinical rotations. For the first time, real patients. Real rooms. Real moments of someone looking at you with fear in their eyes and needing something from you that is not theoretical. My first clinical rotation was internal medicine. Standard. The rotation where most 3rd-year students begin to understand the difference between knowing medicine and practicing it. My attending was Dr. Frederick Owens, who had the particular gift of asking the exact question that revealed the exact gap in your reasoning, not to humiliate you but to show you precisely where you needed to build. He asked me on my 3rd day to present a patient to him. I presented. He listened. He said, "You left something out." I said, "What?" He said, "You tell me." I went back through my presentation in my mind. I found it. I had described the patient's medication history without noting a drug interaction that was clinically relevant to the symptom picture. I said, "The metoprolol and the verapamil. Simultaneous calcium channel and beta blockade." He said, "Yes." "What's the risk?" I said, "Severe bradycardia, hypotension, possible AV block." He said, "And why did you miss it?" I thought about it honestly. I said, "I was focused on the presenting symptom and worked backward. I should have worked both directions simultaneously." He said, "Yes. Don't do it again." I didn't do it again. By the end of 3rd year, Dr. Owens had written me a letter of recommendation that, when I read it years later after requesting my file, described me as the most naturally diagnostic 3rd-year student I have supervised in 18 years of teaching. Naturally diagnostic. Not built for it intellectually. I held those 2 sentences next to each other for a moment when I read the letter. Then I filed it and moved on. 4th year. Residency applications. Emergency medicine. I had chosen emergency medicine for reasons I want to explain because they matter for the story. I had considered cardiology, the direct line from my grandmother's hospital room and her heart and the woman who fixed hearts. But what I had discovered in my clinical rotations was that what I loved most, what aligned most completely with the particular way my brain worked, was the emergency. The moment of unknown. The patient who arrives without context, without history, without a diagnosis written on a chart somewhere, and requires you to build the picture in real time from the information available. The diagnosis under pressure. The intervention that cannot wait. Emergency medicine was where I was supposed to be. And the emergency medicine residency I wanted most was at the University of Chicago Medicine, my own institution, the Level 1 Trauma Center, one of the most demanding emergency medicine programs in the country. I matched there on match day 2015. One of 6 residents accepted from a national pool. My mother cried for 22 minutes on the phone. I know because I timed it and I told her and she said I earned every minute and she was right. My father said, "Mija, I have been telling everyone." I said, "What have you been telling them?" He said, "That my daughter is going to be an emergency doctor at U of C. I've been telling people since Christmas." I said, "I didn't match until today." He said, "I knew." And that was the difference. That simple, unreasonable, completely unearned certainty. He knew. Not because the evidence said so. At Christmas the evidence was ambiguous. He knew because I was his daughter and the idea that I might not be enough was not a concept he had ever entertained for even a moment. I thought about Marcus Collier's restaurant and my father's certainty and the distance between those 2 things. And I drove to Pilsen and had dinner with my parents and we ate my mother's tamales and my father opened a bottle of wine from a shelf he had been saving for an occasion, and it was one of the best evenings of my life. Residency. 2015 to 2018. 3 years of emergency medicine residency at University of Chicago Medicine, Level 1 Trauma Center. I need to tell you about residency with the specificity it deserves because residency is where I became who I am. Not the degrees. Not the match. Residency is where the training becomes the person, where what you've learned in books and lectures and clinical rotations becomes the reflex, the instinct, the capacity to function at the required level under conditions of genuine extremity. My first year of residency, I worked an average of 67 hours per week. I made $54,000 a year. I lived in a studio apartment in Woodlawn, 6 blocks from the hospital, because I had calculated the commute time against the rent and determined that proximity was worth more than space. My apartment had a bed and a desk and a kitchen I used primarily for coffee and the occasional meal when I was not eating in the hospital cafeteria. My senior resident in my first year was Dr. Amara Osei-Bonsu, who is one of the most complete emergency physicians I have ever encountered, and who had a particular way of teaching that I want to describe accurately. She did not tell you what to do. She put you in the situation and watched you do it and then told you afterward exactly what you had done and exactly what it meant and exactly what you should have done differently if you had done it differently. The feedback was always specific, always actionable, never personal. She watched me manage a trauma in my second month of residency. A 29-year-old male, motorcycle accident, multiple system trauma, hemodynamically unstable. I made the right calls in the right order. I made one wrong call. I sequenced 2 interventions in the wrong order, both necessary, but one needed to precede the other for reasons of physiological priority, and I got them reversed. The patient was fine. Dr. Osei-Bonsu corrected it immediately. But afterward in the corridor she said, "Tell me the sequence again." I told her. She said, "Tell me why the sequence matters." I told her. She said, "So why did you reverse it?" I thought. I said, "Because the first intervention was more visually obvious. I went to what I could see instead of what was physiologically primary." She said, "Correct. You treated the loudest problem instead of the most important one." I said, "I won't do that again." She said, "You will. Probably once more. After the second time you won't." She was exactly right. I did it once more 6 weeks later in a different context. After the second time, something reorganized in my brain and I did not do it again. By the end of my second residency year, I had managed 847 emergency cases. I had done 23 emergency intubations. I had assisted on 12 emergency thoracotomies. I had diagnosed a pulmonary embolism in a 26-year-old who had come in complaining of what she thought was a pulled muscle, which was a diagnosis her primary care physician had also accepted, and my suspicion, which was based on a specific combination of subtle findings that did not individually meet threshold but collectively formed a pattern, saved her life. Dr. Osei-Bonsu heard about that diagnosis from the intern who had been present. She came to find me in the residence room the next day. She said, "The PE and the young woman." I said, "Yes." She said, "How did you know?" I told her. Every element of the clinical picture, in the order I had processed it, including the things I had noticed that did not individually constitute a finding but that collectively had made me unwilling to let her leave without a D-dimer and a CTPA. Dr. Osei-Bonsu listened to all of it. When I finished, she said, "That's pattern recognition at a level I don't typically see in second-year residents." I said, "Thank you." She said, "It's not a compliment yet. It's an observation. The compliment comes when you can teach it to someone else." I spent the next 6 months figuring out how to teach it. Third year of residency. I was chief resident. This means something specific. It means the other residents look to you when they don't know what to do, and the attendings look to you when they need to understand what is happening in the department in real time, and you are simultaneously still learning and simultaneously being responsible for the learning environment of the people behind you. It is a position that either makes you or reveals that you are not yet ready to be made. It made me. I finished residency in June 2018. Board certified in emergency medicine. 100th percentile on the written examination. I know this not because I am telling you to impress you but because the number is relevant to the story, because Marcus Collier said I was not built for it intellectually, and the examination board of the American College of Emergency Physicians disagreed at the 100th percentile. I accepted an attending position at Northwestern Memorial Hospital's emergency department. Not the University of Chicago. I wanted to move to a new institution, wanted the particular growth that comes from having to establish yourself somewhere you are not already known. Northwestern was the right choice. Level 1 Trauma Center, one of the highest volume emergency departments in Chicago, a department known for the quality of its attendings and the rigor of its training environment. I moved to a 1-bedroom apartment in Lincoln Park, $2,100 a month, a kitchen with a gas stove and windows that faced east. I bought a rail bed, not a mattress on a frame, an actual bed with a headboard, because it was the first time in 3 years that I had slept somewhere that was not primarily a place to rest between shifts. I made $327,000 a year. I had $41,000 in savings and $164,000 in student loan debt, which put me at net negative, but a negative that was beginning to move in the right direction. I was 30 years old. I was an attending emergency physician at Northwestern Memorial. I was doing exactly what my grandmother had told me to do in a hospital room in 2000. I was fixing people's hearts. Not only hearts, emergency medicine is not specialty specific, which is part of why I love it. But in the first year at Northwestern, I managed 14 cardiac emergencies that required either immediate intervention or immediate escalation to cardiology or cardiothoracic surgery. I was, in the specific and measurable sense, good at the heart cases. My department director at Northwestern was Dr. Patricia Osei, different Osei from my residency mentor, though the name has been kind to me twice, who had been running the ED for 7 years and who had a reputation for being demanding, precise, and entirely unwilling to tolerate any version of good enough when excellent was achievable. She told me in my first 6-month review, "You think faster than most attendings I've supervised. You also sometimes decide before you finish looking. Work on that." I worked on it. Year 2 at Northwestern, 2019. I was 31 years old. I published my first paper, a case series on the diagnosis of acute aortic syndrome in the emergency setting, based on 7 cases from my residency that I had documented specifically because the diagnostic pathway for acute aortic syndrome in the ED was inconsistent across institutions and I believed we could do better. The paper was published in the Annals of Emergency Medicine. It received 43 citations in its first year. My mother printed it. She showed it to everyone at Cook County where she had worked for 29 years. She told me that 3 nurses in her unit had read it. I told her they didn't have to do that. She said, "Raina, they wanted to." I started a research initiative at Northwestern, a protocol for emergency department screening of high-risk cardiac presentations in patients who did not meet current threshold criteria for formal workup. The protocol was based on the pattern recognition principles I had learned from Dr. Osei Bonsu and had spent years refining. It reduced missed cardiac diagnosis in our department by 23 over 18 months. That number, 23, is not abstract. It represents real patients who received correct diagnoses and appropriate treatment because we caught something earlier. Dr. Patricia Osei presented the data at the Society for Academic Emergency Medicine annual conference in May 2020. She credited me specifically. She said, in front of a room of emergency medicine faculty from across the country, "This protocol was designed and implemented by Dr. Raina, who is among the most analytically rigorous emergency physicians I have supervised in 22 years of practice." I was not in the room for this. I was in the ED managing a shift. She told me about it afterward. I said, "You didn't have to say that in public." She said, "I say what's accurate." That was accurate. I said, "Thank you." She said, "Don't thank me. Extend the protocol to the overnight shifts." I extended it to the overnight shifts. Year 3. Year 4. The work deepened. The cases became more complex as my reputation in the department grew, because complex cases get routed toward the physicians who have demonstrated the capacity to handle them. I was the attending called when the presentation didn't make sense, when the picture didn't fit the standard pattern, when someone needed to think fast and accurately and under conditions where being wrong had consequences. I was 33 years old and I was, in the specific language of my field, someone. And then there was Marcus. Not in any present tense way. I had not spoken to Marcus Collier since January 2014, when he moved to New York and we exchanged brief, final, administrative texts about the last logistics of disentangling our 14 months. I had heard about him through mutual acquaintances in the way you hear about ex-partners in a city the size of Chicago, incidentally, without seeking the information. I knew he had done well at the consulting firm. I knew he had come back to Chicago in 2017. I knew from someone who knew someone that he had gotten married in 2018 to a woman named Vanessa, who was a VP at a marketing firm downtown. I did not think about Marcus Collier with any regularity. I want to be clear about that. He was not a presence in my daily life or my daily thoughts. But the sentence he had said on October 19, 2013, "You're just not built for it intellectually," that sentence had a particular location in my memory that was not forgotten. Not front of mind, but present. Like a small stone in a shoe that you've removed and set on the windowsill. You're not wearing it anymore, but you know exactly where it is. I was 33 years old, 4.5 years into my attending career, Director of Emergency Cardiac Protocols at Northwestern Memorial Hospital, when Vanessa Collier came through my doors. November 8, 2022. Tuesday, 11:43 p.m. I was in the final 2 hours of a 12-hour shift. I had managed 14 patients over the course of the evening. I was not tired in the dangerous way. I had learned over years the specific kind of awareness that sustains you through the last hours of a long shift, the way you maintain the level of attention the work requires without burning reserves you don't have. I was in the resident charting room reviewing a case when the radio crackled with the incoming notification. Cardiac arrest, female, approximately 40, return of spontaneous circulation and field, hemodynamically compromised, ETA 4 minutes. I came out of the charting room. I oriented my team. We had 4 minutes. She arrived at 11:47. The paramedics gave me the handoff report in 37 seconds. Efficient, specific, everything I needed. VFib in the elevator of the Waldorf, bystander CPR within 90 seconds, first responders in 6 minutes, 1 shock delivered in the field. ROSC, pressure had been 68 systolic in the field, now 78/42 with aggressive fluid resuscitation ongoing. My resident, Jonah, took the initial intake. I was at the bedside within 90 seconds of her arrival. And that is when I looked at the intake form, and read the name, and read it again. Vanessa Collier. Jonah said. Dr. Reyna. She needs the cath lab. He was right. The clinical picture was clear: cardiogenic shock following what had almost certainly been a ventricular arrhythmia, likely in the context of an acute coronary event. She needed emergent coronary angiography and probable intervention. She needed the cath lab. She needed it now. I said, I know. Get cardiology on the phone. Tell them we're coming up. He looked at me and asked if I knew her. I said I knew her husband. Briefly. A long time ago. And then I stopped thinking about Marcus Collier completely. Because Vanessa Collier was on a gurney in front of me with a pressure of 78/42 and a heart rate of 134, and every second I spent thinking about anything other than her clinical presentation was a second that belonged to her, and that I was spending elsewhere. I will not do that. I have never done that. I moved to the bedside. I introduced myself. She was conscious, groggy, frightened, the specific frightened quality of someone who knows something has gone very wrong with their body and does not know the extent of it. She looked at me. She said, Am I having a heart attack? I said, We think so. We're going to take you upstairs to find out and fix it if we can. Are you in pain? She said, My chest. It's pressure. I said, I know. We're going to take care of it. Is there someone we can call? She said, My husband. Marcus. He was with me. He should be. I said, He's in the waiting room. We're going to let him know you're here. I looked at my team. I said, Let's move. We moved. In the elevator to the 4th floor cardiac catheterization lab, I had approximately 90 seconds. I used them to brief the interventional cardiologist, Dr. Sanjay Mehta, who had been called and was already scrubbing when we arrived. I gave him everything: the field presentation, the ROSC, the pressure, the EKG findings, my clinical assessment of what we were likely to find. He listened with the specific attention of a cardiologist receiving a handoff from an emergency physician he trusts, which is the most valuable thing you can build in a hospital, the trust between departments that allows information to move cleanly. He said, LAD occlusion, you think? I said, most likely. Possibly proximal. The EKG has some interesting inferior leads I want you to look at. He looked. He said, could be a wrap. I said, that's what I thought. A wrap, a right coronary artery that wraps around the posterior surface of the heart and supplies territory that looks on the EKG like it might be LAD territory. An important distinction for intervention planning. He said, good catch. We were at the cath lab. I handed Vanessa Collier to Dr. Mehta. Literally, I transferred her from the ED gurney to the cath lab table, gave Mehta the full verbal handoff and stepped back. Because the cath lab was his room. My job was done. My job had been to get her there alive and with the right information. I had done both. I went back to the elevator. I went back down to the ED. And there, in the waiting room of the emergency department of Northwestern Memorial Hospital, was Marcus Collier. He was standing near the reception desk in what appeared to be formal wear. A suit, the jacket partially removed, tie loosened. He was talking to the nurse at the desk with the particular urgency of a man who is accustomed to getting information by asking for it repeatedly, and who does not yet understand that emergency department family waiting areas do not function on the basis of persistence. He had not seen me yet. I was standing at the entrance to the waiting area. I want to tell you what I felt in that moment because honesty requires it. I felt, and I am going to be very specific, I felt a brief involuntary human satisfaction. Not malice. Not triumph exactly. Something simpler and more complicated than that. The specific feeling of a person who has been told they were not enough, looking across a room at the person who said it, in the context of having just spent 12 minutes keeping that person's wife alive on a gurney. I felt that for approximately 45 seconds. And then I walked across the waiting room. He turned as I approached. He looked at me. And the specific sequence of expressions that crossed his face in the following 3 seconds is something I will keep in my private memory for a long time. First, recognition. Then, confusion, the confusion of someone seeing a person in the wrong context, seeing a face that belongs to one file folder appearing in a completely different one. Then, understanding. The pieces assembling. The white coat. The hospital. The badge that said Northwestern Memorial Hospital. Dr. Reyna, Emergency Medicine. He said, Reyna. I said, Marcus. Your wife is upstairs in the cardiac catheterization lab with our interventional cardiology team. She was conscious and communicative when she went up. We believe she's had an acute cardiac event, and we're working to address it. Dr. Mehta is one of the best interventional cardiologists in the city. She is in excellent hands. He stared at me. He said, You work here. I said, I'm the attending who received her in the emergency department. I managed her initial stabilization and transferred her to cardiology. He said, You're an emergency physician. I said, I'm the attending emergency physician, yes, and the director of emergency cardiac protocols at this hospital. He said nothing for a moment. He was processing. I watched him process. He said, Reyna. I said, Marcus, your wife is having a medical emergency. This is not the moment for any other conversation. A family liaison is going to come and take you to the cardiac waiting area on the 4th floor. Someone from Dr. Mehta's team will update you as soon as there is information to give. Is there anyone else who should be called? He said, her parents. In Naperville. I should call. I said, call them. Use the family room, the nurse at the desk will show you where it is. It's private. He said, Reyna. Said my name again in a way that had a lot of unspoken things in it. Not all of them simple. I said, go call her parents. She needs you focus right now. He nodded. He went. I went back to the ED. I had 2 patients waiting. Vanessa Collier had a proximal right coronary artery occlusion. Dr. Mehta called me from the cath lab 40 minutes later with the findings, which is not standard practice but which reflects the kind of collegial communication we had built in that department. The RAP had been relevant. The territory at risk was larger than a standard proximal RCA presentation would suggest, and Mehta's awareness of it going in had shaped his intervention strategy. He placed 2 stents. The procedure took 63 minutes. Vanessa came off the table with TIMI 3 flow, full restoration of blood flow through the artery, and a pressure that had normalized to 104/68. She was going to be fine. He told me this at 1:24 a.m. I was between patients. I stood in the corridor and I received this information and I felt, not the satisfaction of vindication, not the feeling I'd had for 45 seconds in the waiting room, something quieter and more fundamental. The feeling I always feel when a cardiac emergency resolves correctly. When someone who came in not fine is going to be fine. When the thing that needed to happen happened. That's the feeling. That's why I'm here. That's why my grandmother pointed at a woman fixing hearts in a hospital room in Pilsen in 2000. I finished my shift at 2 a.m. I changed. I was heading toward the exit when Marcus appeared at the end of the corridor. He said, Reyna. They told me she's going to be okay. I said, Dr. Mehta is excellent. She's going to make a full recovery. He said, I know. They told me. I wanted to find you. I said, Marcus. He said what I said. At the restaurant. In 2013. I need you to know. I said, you don't need to. He said, I do. I was wrong. Not wrong about the facts, I was wrong about everything. You clearly have always been. I had no idea what I was talking about. I looked at him. Marcus Collier, 43 years old now, in a wrinkled suit at 2 a.m. in the corridor of a hospital where his wife had just been saved from a cardiac arrest. He looked, for the first time in my memory of him, genuinely humbled. Not performing humility, actually feeling it, in the way that a night like this one tends to reorganize a person's relationship with what they think they know. I said, Marcus, in 2013 when you said those things, I had a 3.88 GPA and a 92nd percentile Step 1 score in a research position in Dr. Soto's lab. You said I wasn't built for medicine intellectually. I want you to know that it hurt. Really hurt. Not because I believed you, I didn't fully, though I'd be lying if I said some small part of me didn't wonder. It hurt because I had trusted you with the part of myself where the uncertainty lived, and you used it. He said, I know. I said. And I want you to know something else. I didn't become what I am to prove you wrong. I became what I am because my grandmother pointed at a doctor in 2000 and told me to do that. Because I am genuinely good at this and I love it in a way that has nothing to do with you and never did. You were a detour in the narrative. Not a chapter. A footnote. He was quiet. I said, your wife is going to recover. She'll need cardiac follow-up and lifestyle modifications, and probably a conversation with a cardiologist about risk reduction. Dr. Mehta's team will go through all of that with her. She's going to be fine. He said, thank you. For all of it. I said, I was doing my job. He said, you were doing more than your job. I said, no. I was doing exactly my job. That's the point. I walked to the exit. The November air outside was cold and clear, the particular cold of Chicago in November that means business, and I stood outside for about 2 minutes before getting in my car, just standing in the cold and thinking about nothing and everything simultaneously. I thought about Promontory in 2013. I thought about the Green Line home and the anatomy practical on Thursday. I thought about Dr. Osei-Bonsu saying you treat the loudest problem instead of the most important one. I thought about 23 reduction in missed cardiac diagnoses and 43 citations in the annals and the 100th percentile in Dr. Patricia Osei saying analytically rigorous at a national conference. I thought about my father's certainty at Christmas. I thought about my grandmother's hands and the hospital room and the woman fixing hearts. And I thought about Vanessa Collier, who had gone home from the Waldorf in an ambulance and had come out the other side of one of the worst nights of her life because a team of people had done their jobs with precision and care. Because Dr. Mehta was excellent with a catheter, and because his interventional plan had been informed by information I had identified and communicated correctly. Because someone had noticed the EKG finding that suggested a wrap. That was the thing. Not Marcus. Not the restaurant in 2013. That was the thing. Vanessa Collier was going to wake up tomorrow and every day after and her heart was going to beat because of work that had nothing to do with proving anything to anyone and everything to do with being precisely, completely, irreversibly good at something that matters. I drove home to Lincoln Park. I made tea. I stood at the east-facing windows and watched the city in the early morning dark, the lights on the lake, the particular quiet of Chicago at 2:30 a.m. when the city has not yet woken up again. I called my mother in the morning. Not to tell her about Marcus. I did not tell her about Marcus because Marcus was, as I had said to him, a footnote. I called her because I call her on Wednesday mornings when I've worked a night shift, because she is always awake and she makes coffee early and she likes to hear my voice after I've worked a hard night. She said, "How was the shift?" I said, "Busy. Cardiac case, serious, good outcome." She said, "You sound okay." I said, "I'm okay. Tired." She said, "Come Sunday. I'm making tamales." I said, "I'll be there." She said, "Your father wants to know if you need anything." I said, "Tell him I'm good." She said, "He knows. He just likes asking." I said, "I know." She said, "Raina." I said, "Mija." She said, "Are you really okay?" I said, "Mom, I'm more than okay." And I was. I want to be clear about that. Not the performed okay of someone who is managing, not the functional okay of someone who is getting through. The real okay. The okay that comes from being in the right place, doing the right thing, with enough of yourself built that the old wounds have scar tissue over them and the scar tissue is strong. There is a version of this story that is about revenge. About Marcus sitting in a waiting room while his wife's life depended on the woman he had dismissed. About the symmetry of that, the specific justice of it. And I will not pretend that symmetry meant nothing to me. I told you it meant something for about 45 seconds and I told you honestly. But here is the true version. the version that is actually the center. I was not in that emergency department to be vindicated. I was there because emergency medicine is where I belong, where I have always belonged, where my grandmother pointed me when she was 68 and frightened and watching a woman fix hearts with the specific attention of someone for whom attention is a form of respect. I was there because 14 years of work, the undergraduate scholarship and the Pritzker acceptance and the anatomy practicals and the step 1 at the 92nd percentile and the residency at University of Chicago and the 847 emergency cases and the protocol that caught hearts that would otherwise have been missed and the paper that someone cited 43 times. All of that had made me exactly the physician that room needed at exactly that moment. Marcus Collier's opinion of my intellectual capacity was irrelevant to all of it. Not because it didn't hurt. It did. But because the hurt was never the engine. The engine was the heart. The four-chambered muscle the size of a fist. The woman in the hospital bed in Pilsen in 2000. The direction set by a grandmother's hand. That's what brought me to that room on November 8, 2022. Not him. Never him. I want to tell you one more thing. A postscript because the story has one and leaving it out would leave the telling incomplete. 6 weeks after the night of Vanessa Collier's cardiac arrest, I received a letter in the mail. Not an email. A physical letter handwritten on personal stationery. From Vanessa. She wrote, Dr. Reyna, I know you may have known who I was when I came through your emergency department. I asked Marcus and he told me everything. I want to thank you not just for the clinical care, though that was everything, for what Marcus told me you said to him in the corridor. That you were doing exactly your job. That's the part one think about. Because I think there are people who do their jobs and people who are their jobs in the way you seem to be yours. I don't know what I would have done in your position. I think most people wouldn't have been as complete. I'm grateful to be writing this letter. I'm grateful to be writing anything. I read the letter 3 times. Then I went to the kitchen and made tea and stood at the east-facing windows and thought about my grandmother. She told me to fix people's hearts. I'm fixing them. Every shift. Every case. Every patient who comes through those doors not knowing what's coming and leaves knowing that something was caught that might have gone uncaught, that something was fixed that might have gone unfixed, that someone was in that room who knew exactly what they were doing and why. Not for Marcus. Not for the footnote. For my grandmother. For my mother who read the paper. For my father who told everyone before match day. For the 23%. For Vanessa's letter. For the work. Always only entirely for the work.